Okay, so let me pick up from what I was saying. That last bullet point here for the carrier-mediated diffusion refers to the number of channels, all right, and the rate of substance transport. So I believe I was in the process of drawing out this slide here. Meaning, so if this is the number of channels, I'll just put C, and this is the rate of the substance transport. As we increase the number of channels, we'll increase the rate. But eventually, we'll hit a max, and it'll just plateau. That's what that slide is saying, okay? And if you get into other more detailed physiology courses, especially like exercise physiology, that's an important principle, especially when we're talking about concepts like VO max, which is the amount of oxygen that your body will use. But just kind of keep that in mind. We'll eventually reach a plateau point when we're talking about the maximum rate for the transport because we've exceeded the number of carriers. Just we can't do anymore. There's no more room in the plasma membrane to stick these carrier proteins. Okay? All right. Again, there's that picture there of the carrier-mediated diffusion. All right, onward to the next passive transport. Type of passive transport. Osmosis. Remember what I said. Osmosis involves water. Okay? So you have to have water. So the only thing, this is really important, I want to hammer this home. The only thing that moves, like in diffusion, it was any type of molecule, small, all right, and non-polar for the most part. Well, it could be small and polar, but it could have been sodium, it could have been chloride, it could be glucose. All right, those things were moving. All right, when we're dealing with osmosis, the only thing that moves is water. Okay, we'll talk about the role of solutes. All right, those are small particles also. They don't move. Okay, they don't move. So when we're dealing with osmosis, all right, we deal with the movement of water, and we deal with the movement of water through what we call a selectively permeable membrane. Hey, guess what? Your plasma membrane is a selectively permeable membrane. Okay? So the examples that we're going to be using will involve the plasma membrane. So basically what we're going to be talking about is the movement of water and nothing else across your plasma membrane, which is a selectively permeable membrane. Okay? So keep that in mind. We'll move water, but, all right, most of the solutes, not all, but most, but for our purposes, we're going to say that the solutes aren't moving, all right, will stay while water moves, okay? So essentially, we're going to be talking about the difference, all right, that water has inside the cell and outside the cell. Is there more water outside the cell? Is there more water inside the cell, okay? So that's what we're going to be talking about on either side of our selectively permeable membrane, but in this case, our selectively permeable membrane is going to be the plasma membrane. Okay, so just to kind of keep that in line here. All right, so one of the ways that water can move across the plasma membrane is right through the phospholipid bilayer. It can slip in between. And in some situations, cells, I love this, they're clever, and what they're going to do is they're going to recruit or make these integral proteins, all right, and stick them in the plasma membrane, and they act as water channels. So these plasma proteins, or not plasma proteins, plasma membrane integral proteins are specific for water, and so we give them a special name, aquaporins. All right, so basically it's like having a boat, all right, and I just start punching holes into my boat. It's going to let more water in that way. That's what the aquaporins will do. We start punching holes into the cell membrane specific for water, all right, we call those aquaporins, then more water can move across the plasma membrane, either into the cell or out of the cell, okay? So we talked about water, but now we're going to talk about solutes, okay? So think of it like this. Solutes are everything else. So you have water, and then you have everything else, which we're going to call solutes, okay? So the permeable solutes can pass right through that lipid bilayer, no problem. We talked about this before. The respiratory gases, those are permeable solutes. They can move in between the phospholipids through the plasma membrane. Okay? Urea, remember that was a cell waste. It's a nitrogen base substance. That too can move through the phospholipid bilayer. So we refer to those as permeable solids because they can permeate through the plasma membrane. The non-permeable, all right, those are the ones that can't cross through the bilayer. All right, so we already know what those characteristics are. If they're big, all right, real big, all right, like other proteins, they can't just move through the plasma membrane. They're not small enough. If they're polar, all right, and they can be charged, all right, like ions, okay? So keep that in mind. So these three characteristics, charged, polar, or large solutes, cannot move through the plasma membrane. All right, so for ions, all right, and glucose, we have facilitated diffusion channels. Remember leak channels and then our gated channels? And then for glucose, we have the carrier-mediated diffusion, right? Now, proteins can be big, and we'll talk about that. Overall, proteins will actually have a negative charge to them, okay? That comes into play later on. All right, do you understand the difference between permeable solutes, non-permeable? All right. All right, so let's jump into the concentration gradient because we dealt with the concentration gradient with diffusion, okay? So in this situation, our concentration gradient, same concept here, all right? So when we're talking about our concentration gradient, we're going to deal with what's inside the cell and outside the cell. So if you're outside the cell, we're dealing with the interstitial fluid. If we're inside the cell, we're dealing with the cytosol, okay? So that plasma membrane will create, all right, a water concentration gradient here, all right? So this is big. If you understand this concept on this slide, then when we talk about osmosis and the concept of tonicity, you will have an easier time. I'm going to read this out loud to you. The greater the concentration of solutes, all right, contains a lower concentration of water. So it's like an inverse relationship, all right? As long as memorize that, all right? I'm going to try to help you to understand it, but memorize that. Meaning, if you have a lot of solutes, all right, in one area, you're not going to have a lot of water, okay? And vice versa. If you have very little or very few solutes in one area, you'll have a lot of water, okay? So think of it like you have two beakers, okay? And I fill up, and they're the same size. I know that doesn't look like it. It looks awful, all right? So I fill up one beaker with a lot of stones in it, big stones, okay? And my goal is to fill it to the top. And then my other beaker that's the same size, okay, I have two stones, all right? And I start to fill up both the beakers with water. Okay? All right, so I fill them both up with water. Which beaker do you think will have more water in it? The one on the right side of the screen, or we'll say this is A and this is B. Which one will have more water? B. Okay? So think of the stones. That's right, Michael, that's right. So think of the stones as solutes. Okay, that kind of concept. Right, they're going to take up space, so water can't, you can't have two things occupy the same space. It's one of the principles of physics. You know, matter cannot occupy the same space. Okay, so two different forms of matter, two different matters cannot occupy the same space. So that's what we're talking about here. Okay, so think of all those rocks as solutes. All right, if you have a higher concentration of solutes in beaker A, all right, than beaker B, okay, you'll have less water in beaker A than you will in beaker B, okay? Kind of keep that idea, because now when we're talking about osmosis, right, what does water, the only thing that can move in osmosis is water, right? We already agreed upon that. The solutes can't. So if we put an aquaporin, all right, if we put, and now we took a little bit of water out, so there's a little bit of space for water to move. So if we put something to connect both of these beakers, where do you think water wants to go with our understanding that we're going to move things down the concentration gradient? And water will want to move down its concentration gradient. So where does water want to go? From beaker B to A? I think that's what Michael's saying there too. Yeah, it's going to go, all right, to where there's less water. So by saying that, am I also saying that water is going to want to move to the area of greater solute concentration? Yeah, okay? So that's another way that we can look at it. All right, it wants to go from an area of high water concentration, from beaker B, all right, to an area of lower water concentration into beaker A. I'm apologizing for my horrible drawing here. I know, I wish I had better talent with that, okay? So at the same time, we can say that water is going to move from an area of low solute concentration to an area of high solute concentration, okay? So that's what we're saying here. All right, when we talk about the movement of water through osmosis, all right, it depends on our concentration gradient between the inside of our cytosol, the inside of our cell, and now we're going to talk about the solution. So normally I said the cytosol and the interstitial fluid or space, that's the space outside the cell. So now what I'm going to do is, I'm going to talk about this later on, we're going to talk about tonicity. We're going to take a red blood cell, one single red blood cell, and we're going to put it in a solution. And these solutions have varying concentration gradients of solutes. And we're going to talk about what's going to happen. All right, that's probably not going to be today. Okay? So same type of thing with osmosis. Water is always going to move down its concentration gradient until equilibrium is reached. Okay? Same principle as we saw in diffusion. All right, diffusion will continue until equilibrium is reached. When we have equal amounts on both sides, then it stops. Same thing with water. Once water, all right, has equal amounts on both sides of that plasma or that selective permeable membrane, all right, it will stop. All right, and we'll talk about this example here, how it moves from a solution of 1% solutes and 3% solutes. All right. So that's what we're talking about here. So it moves from a solution of 1% solutes because it has a higher water concentration. Because if you have 1% solids, isn't 1% lower than 3%? Right? So we have fewer solutes, all right, in this example than in this one here. All right. I'll show you another example here. But this is what we're looking at. Zoom in. All right, this is what we're seeing here. On our left side of our screen here, all right, this is inside the cell. Okay, this is the cytosol. Okay. Also known as the intracellular fluid or space, ICF. This is the outside of the cell, also known as the extracellular fluid or space or interstitial. I won't spell out interstitial. All right. All right. So you need to know some of those terms there. ICF, ECF, inside, outside the cell. Okay. So if we look though, these red dots all represent water molecules. Does it look like there's more water on the right side of our screen than the left side of our screen? All right. So with what we know about osmosis in water, which direction is it going to want to move into? It's going to want to move from the right side of our screen to the left side of our screen. We all agree? Okay, good. So you understand osmosis. It's that simple. Okay, don't make it complicated. It's that simple. Okay, good. That makes me happy. All right, which leads me into the next concept of osmotic pressure. We will revisit this when you get into the circulatory system. So please, if you understand it now, you don't have to learn it in 211. Okay. So osmotic pressure, the definition is that it's the pressure that's exerted by the water as it moves across that semi-permeable membrane or the plasma membrane. Okay? So let me ask you this. You're going to take a bath, and you turn the faucet onto the bathtub. You turn the faucet on just a little bit, and you get a little bit of water, and then you turn it up all the way, and that water comes pouring out. Would you agree, all right, that A, more water is pouring out of the faucet? Would you agree on that? Okay, good. Would you agree that the pressure of that water that's pouring out of the faucet is greater than when you first turned that faucet just a little bit and it's dripping out? Okay. Now you understand osmotic pressure. Okay? That's what think of it like that. Okay? The faucet analogy, right? So as water is moving across that semi-permeable membrane, if we get more water moving across, we'll have more pressure. We have just a little bit of a trickle, we won't have much pressure. Okay? Cool? All right, good. I love it. You guys are awesome. All right. So, remember what we said. All right? Water will go from an area of high concentration of water to low concentration of water. But we can also say that water is going to move in the direction of the higher solute concentration, right? Okay? So that's what we're talking about here, due to the difference in solution concentration. All right? So the movement of water can be influenced by, if you have hardly any solutes on one side of the plasma membrane, but a ton on the other side, all right, water's going to just pour across there. It's going to want to go, all right, to where there's a lot of solutes. But if you have maybe on one side of our wall, you got, here's a solute, here's a solute, and here's a solute. And on the other side of the wall, you got 1, 2, 3, 4. Now, we can all agree that water's going to go this way, right? Okay? But, I mean, there's only a difference of 1. Now, same scenario, same solute. Say we had 2 and 200. Wouldn't you say more water is going to rush across? All right? Because you'll have tons of water on this side here, because you only have 2 solute molecules, and you won't have a lot of water molecules on this side because you have 200 solute molecules. All right? So that's what's going to help to influence. Yes, ma'am?
But if there's all these solutes in there, where's the water going? Even though there's less water in there, you have all this other stuff in it.
Right, right.
How is it going?
Well, again, also don't think that the compartment spaces will be equal. You know what I mean? Like, perfect example, a red blood cell, all right? Very, very small, the internal environment of that red blood cell. But if you were to take that red blood cell and drop it into a bathtub, all right, or a pool, all right, there's still, you're not going to be limited by that size and space. So that pool could have, say that red blood cell has 100 molecules of sodium on the inside of it. And you drop that red blood cell into a swimming pool that only has 1 sodium molecule in it. So where's that water going to want to go? From the inside of the, wait a minute, I used the wrong example. Give me 1 second. Let me rephrase that. All right, you got your red blood cell. It's got 1 sodium molecule on the inside. You drop it into the swimming pool, size whatever, that's got 100 sodium molecules. All right, where is water going to want to go? From the cell into the swimming pool, right? So it really won't make much of a difference there. If it's a smaller compartment, then yeah, you see, you're going to be limited. There's other factors involved. Yeah, there's definitely other factors. All right, so same type of rules apply. Steeper the gradient, okay, will affect the rate of the movement. Remember how we said in diffusion, the steeper the concentration gradient, all right, the faster that rate of diffusion. All right, the steeper the concentration gradient here, all right, the more water will be moved, okay, across that plasma membrane. Therefore, we'll have a greater osmotic pressure. It's not a very steep gradient, like that example. This is not a steep gradient, this example I have over here, where we have 3, all right, solute molecules and 4 solid molecules. That's hardly any gradient there. Here, the 2 and the 200, that's a very steep gradient. So that osmotic pressure is going to be, this is when we first turn our faucet on for the bathtub where it's trickling out. This is when we turn that thing up, that baby up full blast, and that water's just shooting out. Okay, that's what we're going to see here, which leads me all the way to this guy right here. Hydrostatic pressure. Need to know what hydrostatic pressure. Hydro is water. Okay, so hydrostatic pressure. This is the pressure that a fluid, all right, in this case the water, but we're going to be using it when you get into the blood. You'll be talking about a couple other things. But this is the pressure, all right, that water is going to exert on the wall, like pipe, for example. Okay, the pipes in your walls, the pipes in this building with water. Okay, when the water moves through that pipe, yes, it's flowing down the pipe, but it's also going to be pushing on the pipe walls. Okay, that's what happens in your blood vessels. Okay, the fluid, in this case, our blood, as it's traveling through our veins, our arteries, our capillaries. All right, it's going to. Let me give you a horrible drawing here. All right, it is going to, yes, be moving down. All right, the blood vessel in one direction, but as it's doing it, it's also pushing. All right, that because this whole container is full of that fluid, it's going to be pushing on the walls. And so we refer to that pressure, that movement of that fluid down that pipe, or that vessel, that blood vessel is pushing on the walls. We call that the hydrostatic pressure. Okay? And when we get to capillaries are only one cell layer thick. Remember endothelium, simple squamous? That's what your capillaries are lined with. Simple squamous epithelium. They're one cell layer thick. So if you turn up the hydrostatic pressure, the capillary becomes much leakier because it can only hold so much of the fluid in. All right? All right, this picture here is a nice example of hydrostatic pressure. All right, so here you can see, all right, side A and B, here's our semi-permeable membrane. And if you look, the black balls represent the solutes and the red balls represent water. Okay, so if you look, side A, you got 1, 2, 3, 4, 5, 6, 7, 8 black balls, 4 black balls on side B. So, which side has the higher solute concentration? I know the answer's up there. I should try to hide that. Side A. All right, side A has the higher solute concentration. See, all these black balls, all right, on one side. So, which direction does water want to go? It wants to move from side B to side A. So like this, right? Yep, okay, so we look here. That's what happened. Okay, it moved from side B to side A. Okay, because it went towards the area that had the higher solute concentration, but it was also the area that had less water. Okay, if you want to go through and count all the water molecules, have at it. All right, if you just by looking at it, you can see more red dots over here than red dots over here. Right, so that's a lower water concentration. And now we've equaled it out. Okay, all right, good. Good. Usually I spend a lot more time on that. All right, let me finish up with tonicity, and then we'll switch over to lab stuff. Okay. All right. So osmosis and this concept called tonicity. All right. So understand. All right. As water moves, all right, in and out of cells, all right, through the process of osmosis, that will change the volume of the cell. So how big it is, it's like puffing your cheeks out, okay? Puff my cheeks out, the volume of my mouth has increased, it's bigger, all right, my oral cavity, all right? So when we have water moving in and out of cells, we'll get a change in the cell volume, how big or small it is, and also the osmotic pressure, okay, that force of that, or the pressure of the water as it's moving, okay? So we have this term called tonicity here. Okay, and this basically describes the ability, all right, of a solution. So now, all right, we're going to take I'm going to use the red blood cell because we're going to see that here in an example. I'm going to take that red blood cell and I'm going to put it in a couple different solutions, all right, and that solution is going to have it's going to affect that cell or it's not going to affect that cell. And if it affects the cell, it's either going to increase that cell's volume or it's going to decrease the cell volume. So there's 3 possibilities that a solution can cause on a cell. It can either increase the cell volume, it can decrease the cell volume, or it can make no change whatsoever to the cell volume. Okay? All right, so keep that in mind. So the ability of the solution to change the volume or the pressure, which is what we refer to as tone, of a cell by osmosis, the movement of water. Okay? So as our water moves, if it does move, okay, if that water moves, it's going to affect the cell volume or the osmotic pressure. Okay? And it depends on the solution. All right? So we call that tonicity. All right? So there's 3 types, all right, of tonicity, all right, or concentration of solutes in the solution of whatever we're going to drop our red blood cell in. All right, so these are the 3 names, and I'll explain it all. Iso meaning no change. All right, hypo meaning decreasing, hyper meaning increasing. Okay. So this is going to describe, all right, the concentration, all right, of our solutes in the solution in which we're going to drop our cell into. I'm going to use the red blood cell because that's what the book uses. All right, let's talk about the first one here. Isotonic. So again, iso meaning no change. Okay? So this type of solution will not cause any type of pressure change in the cell or cell volume change. So what that means is that inside the cell, which is the cytosol, and outside the cell, in our example, that's the solution, have the exact same number of solute concentration. Okay? So, going to my picture here, here's our plasma membrane. I've got 10 molecules of the solute inside the cell, 10 molecules of the solute outside the cell. Which direction does water want to move? Stays there. Does not move, right? Because we already agreed. Water is going to move to the area of greater solute concentration. Well, last I checked, 10 and 10 are the same. There's no difference. Would we all agree? Bam. Then you guys are killing it. Because that's what normal saline is. All right? And so when you give a patient normal saline, if they're hemorrhaging blood, okay, you want to keep blood in the circulatory system. So they've cut an artery, they're bleeding out, their blood pressure starts to fall, we need to keep the blood pressure up. We give them normal saline, which has this percentage of sodium chloride in it, all right? And that's to increase the blood volume, all right? So you don't go into shock, okay? Because if your blood pressure drops too low, then you can go into shock, pass out, die, all right? That's not good. So isotonic solutions, no movement of water, okay? So this is what we refer to as it's isotonic to erythrocytes, which are red blood cells, which means water will not move into the red blood cell and it won't move out of the red blood cell. So the erythrocytes are happy. All right, so that's an isotonic solution. All right, the next type of solution is hypotonic. Okay, so we say hypo, it means it's lower. Okay, so this type of solution has a lower concentration of solutes. So again, here's our example. All right, 10 is on the inside of the cell, and we'll use 5 is on the outside of the cell. Okay, so which direction does water want to move? You got it. Water wants to move into the cell, towards our left. All right, and that's what we're seeing here. That means the solution has lower concentration of solutes, higher concentration of water. All right, so if we take red blood cells and put them into pure water, water moves down its concentration gradient. It's going to increase the volume, all right, as the pressure of the cell increases because water is moving into the cell. And that's going to cause our red blood cells to burst. They're going to pop like a balloon. It's like filling up a balloon. As you keep blowing air into the balloon, what are you doing? You're increasing the pressure, all right, that air pressure on the walls of the balloon as you keep inflating it. And that's what will happen with these cells. All right? The red blood cell will pop or rupture, and we refer to that as hemolysis. So that's why it's crucial if you're a person that's going to be hanging, all right, an IV bag onto somebody, that you're using the right bag. Because if that solution is hypotonic, and you start pumping that into somebody, all right, especially with somebody that has anemia, for example, all right, they already have a low red blood cell count, now you're just going to start killing blood cells. That's bad. All right? Okay, so that's the hypotonic solution. All right, so hypotonic solution causes cell rupturing, and if it's a red blood cell, we call it hemolysis. And the final one is hypertonic. Okay, that means the solution has a higher concentration of solutes than the inside of the cell. So going back to our example, here's the inside of our cell, and then the outside of the cell has a higher concentration of solutes. So in our example, where is water going to go? All right, towards the right, towards the outside. So water is going to move from inside the cell to outside of the cell because, again, it moves down its concentration gradient, all right, and that's going to decrease the volume and the pressure inside the cell, okay? And that's going to cause shrinkage of the cell. We call that crenation. Not cremation, but crenation. Cremation is something different. When you burn a body and turn it into ash, okay? Crenation is going to be cell shrinkage. All right, one last slide, and then we're done with this concept. All right. These pictures here are basically showing you what I'm talking about. So here's that first one here, an isotonic solution. You can see here's our red blood cell. All right, the red blood cell has equal solute concentration inside, all right, to the solute concentration of the solution or outside the cell. So no movement of water. So this is what it looks like, all right, on an electron microscope. Kind of cool. All right. Now the second one, we get into our hypotonic solution. All right. So the solute concentration is much less outside the cell than inside the cell. And you can see, all right, you got all these little purple balls inside the cell and very few outside the cell. So water is going to rush in, and it causes our cells to get big like this, and then eventually they start to pop. They lyse. Lyse means to break down. Okay? And then our last one here, all right, this is a hypertonic solution. You can see there's a few purple balls inside the cell, and there's tons outside. So water, all right, moves outside the cell, and the cells literally just kind of shrivel up and shrink up. Okay? It's like you got a balloon, you fill it up to the normal amount, you let the air out. It shrivels up. Same type of concept. All right. Any questions for me? We only did a few slides, which is, I'm really happy with what we did. But there's a lot of information there. All right. You can see how long it took me, you know. So we will wrap this up. It's the weekend. What I might do is just, I'm going to pause this. Hemolysis was the rupturing. Yes. Heme is referring to the red blood cells, the erythrocytes, and so yes, it's the rupturing of the erythrocytes. You got it.